And now it's the time to start the international session. And today is the 1079th day of uninterrupted daily webinar of International Forum for Promoting Homeopathy. And before beginning the session, let's have a silent prayer. Hello, doctors, students of homeopathy, and friends of homeopathy. Today is the 1079th day of uninterrupted daily webinar of Ifph. And today's our guest is Dr. Kulwant Singh, ex-Dean, Faculty of Homeopathy, Vinoba Bhave University, Hazaribagh, Jharkhand. He is a principal of Singbam Homeopathic Medical College and Hospital, Jamshedpur since 2000, teacher since 43 years, professor, SHM College, Jamshedpur, presented several seminars in and outside India, attended Arab Health Congress, Dubai 2014, a resource person, seminar, Ministry of Ayush at Vigyan Bhavan, New Delhi 2016, resource person, seminar on homeopathy by Central Council of Homeopathy, Siri Fortis Stadium, New Delhi 2016, resource person, all CCH workshops in India, have presented several seminars at Ranchi, Patna, Kanyakumari, Trivandrum, Goa, Jhansi, Udaipur, ex-chairman, Homeopathy Literature Committee, CCH, New Delhi, ex-member, Education Committee, CCH, New Delhi, PG Gate, Rajasthan Vidyapith, Udaipur, ex-inspector, Central Council of Homeopathy, New Delhi, and our subject is the second part of Polycystic Ovarian Disease, its homeopathic approach. The previous part we had with Dr. Kulwant Singh on the previous Tuesday, and it was great. It was a great session. We studied about LH, FSH, progesterone, estrogen, how these are all being controlled. And I think a synopsis of will be given by Dr. again a little bit, because some new doctors will be here. And it was an excellent class, sir. Let's begin. Welcome to the session, Doctor, and welcome all for the session.
Am I visible, sir?
Yes.
The screen is visible. Am I audible?
Yeah, audible and visible.
Thank you, sir. Thank you so much. I welcome you all and wishing you all a happy Independence Day. I'm thankful to give me a chance to speak again on PCOS. There's not much of time, so we'll come directly to the point. In the last lecture, as Dr. Binduraj told, that we discussed every aspect of hormonal imbalance in the case of PCOD or PCOS. So in short, I would like to show this only. So what happens when there is, due to lack of follicle stimulating hormone, there is no growth of the follicles. You can see this. These are small follicles which are not growing. These are the small follicles which are not growing. So there are small follicles, they do not mature, and the part is 2 to 6 mm size. Normal growth of ovarian follicle when it is matured is 18 to 20. So this 18 to 20 mm size follicle will be considered as mature. 2 to 6 mm is not mature. But what happens due to less of follicle stimulating hormone? You can see this follicle stimulating hormone, the blue graph, this is straight. There are no fluctuation. The FSH is not more, the FSH is not less as per the demand of the body. So what happens? Though there is less secretion of follicle stimulating hormone, these small follicles, they secrete a small quantity of estrogen. So this small quantity of estrogen, though it cannot mature a graphene follicle, but this small estrogen, you can see due to the secretion of these small follicles, the estrogen level is increasing. The follicles are not maturing because the level is not so high, but it is increasing. Normally what happens, high estrogen sends a signal to the brain that I don't need estrogen, please send some luteinizing hormone, LH. So due to this signal, the LH is more. You can see the secretion of LH is yellow line. It is increasing, increasing, increasing. But LH, what is the function of LH? After the Graafian follicle matures, it releases the egg due to the high LH level. It helps in the bursting of the Graafian follicle so that egg should come out. But in this case, estrogen is high. Estrogen is not working on the Graafian follicle. They are not maturing. So when the LH comes here to mature them, there is no maturity. What happens when the Graafian follicle matures? The egg is released and the remaining part is known as progesterone. Sorry, corpus luteum. And corpus luteum secretes a hormone named progesterone, which goes into the endometrium of the uterus and make it secretive. The high estrogen is there. It is not maturing the follicle, but high estrogen is maturing the endometrium, uterine endometrium. So uterine endometrial wall is thickening, it is maturing, it has become tortuous, it has become soft due to this high estrogen, but the follicles are not maturing. So there is no egg, there is no corpus luteum because it is not bursting. If there is no corpus luteum, there will be no progesterone. It will not go here. So in short, what happens? The endometrial wall becomes thicker, longer, elongated, but there is no mens because there is no maturation of the Graafian follicle in case of PCOS. FSH is low, almost in the same level. There is no fluctuation. The estrogen is high, so it is maturing the endometrium. There is no progesterone, so it is not coming here. So what happens? There is no menstruation. There is anovulation, no ovulation. That condition is anovulation. The anovulation causes infertility. But what happens in these females after 1 month, 2 months, 3 months? What happens? This endometrial wall becomes thick, and ultimately in the upper part of the endometrial wall, there is no blood supply. So that part becomes ischemic. So due to ischemia, there is no blood supply. It starts degenerating. This is after 60 days, 2 months. This is after 90 days, 3 months. So whenever, depending on the patient to patient, this starts, there is ischemia, and this part starts degenerating and there is bleeding. Patient doesn't know. The patient is not aware, but patient will come to you and explain that, doctor, I was not having mens for 60 days or 90 days, and now my mens has started. When you will test her blood, all the tests will indicate that she is a patient of PCOS. So this is not a menstrual bleeding. This is a simple bleeding due to the ischemia of the top part, topmost portion, and there is, due to estrogen, there is endometrial wall thickening. So from all these parts, there will be some bleeding, maybe 60 days, maybe 90 days, maybe 70 days. Patient will come to you, say that I am having menstrual, but that is not a menstrual bleeding. That is simple bleeding, and reason is obvious. So this was in just the last part which we discussed. And you see how the endometrial wall thickens. This is a normal endometrium, single lining you can see, but due to the heavy dose of estrogen and progesterone. So obviously more by estrogen level. So if the estrogen level goes high, you can see there is severe congestion, proliferation of the uterine endometrium. And the blood comes from this area, which I explained in the last slide. So blood comes from this area and there is bleeding, but these are not menses. Come to the next. I'll go a little faster today because time is very limited. And this is a very vast chapter. So one of the most reason I discussed in the last lecture also that there is insulin resistance. The patient is insulin resistant. So insulin resistant patient will have a higher insulin level in the blood. And higher insulin level has its own effects. We will come to that. So for proper growth of the ovary, of the follicle, of the things, it needs insulin, it needs glucose. This is ovarian arteries. Ovarian artery blood supply is there. From the ovarian artery, the glucose and insulin goes to the ovary for its normal growth. If there is insulin resistance, sometimes what will happen? There is less glucose intake. So if there will be less glucose intake, there will be less growth of follicles. This can be genetic. But as it is insulin resistant, when there is insulin resistant, the serum insulin will be more. So when you will check the blood of this patient, it will be having serum insulin, fasting is high, it is more than 25. So this kind of a patient where when you will check the patient, the blood test is done, serum insulin is done, and serum insulin is high. It means the patient is insulin resistant. This is a very important aspect in cases of PCOS because insulin resistance has its own effects. Basically, it increases the secretion of androgens. If androgen secretion is more, the level of male hormone is more. The level of male hormone is more, the patient suffers from PCOS. So this is a very important aspect. So what will we get? This is just a summary of the PCOS patient. There will be, I told you, an ovulation. If there is no ovulation, there is no maturation of Graafian follicle, there is no ovum coming out, oocyte coming out from the Graafian follicle, there will be no menses, there will be no menses, there will be no oocyte. If there is no oocyte, the sperm will go and never unite. There is no fertilization. So that condition is known as anovulation, which leads to infertility. Sometimes there is oligomenorrhea. So oligomenorrhea is less menses, but delayed menses. So the patient may have menses once in 3 months, one is 4 months. So this condition is known as oligomenorrhea. And in this case, obviously the patient will say that there is amenorrhea because the menses are not happening properly. They are coming in 2 months, 3 months, 4 months, like that. And there is hirsutism. I told you that hirsutism is one of the most important symptoms which is visible in case of PCOS. Whether there is a cyst in the ovary or not, but hirsutism, acanthasis nigricans, and severe acne. These three are, I explained you last time, Rotterdam's criteria. So there are 3 criteria. One was more androgen levels. Second was hirsutism and acanthasis nigricans, which I will come to now. Obesity is causing insulin resistance. Obesity is one of the most important factors for insulin resistance. Plus, if the patient is obese, the fatty tissues, the adipose tissues, they tend to make more androgens. So more androgens, more insulin resistance, more chances of PCOS. Normally, the luteinizing hormone and follicle stimulating hormone, the ratio, the proportion is 1:1. FSH is there, it increases, its level goes to the brain, it releases LH, the LH goes high, there is ovulation, then it comes down. But in general, the ratio is 1:1. But I told you in the last slide that when what happens, the Graafian follicle doesn't mature, the estrogen doesn't go to the brain, it doesn't ask to stop the follicle stimulating hormone and release LH hormone. So LH hormone is increasing. So LH hormone is increasing, FSH is low, so normal is 1:1, but this in case of PCOS you will get it may be 3:1 or more. When this proportion is 3:1, we will say that this can be case of PCOS. Less than 3, we consider that, okay, he is prone. The patient will be prone to that. The increased testosterone, I told you just now, the obese patients, the PCOS patients are having increased testosterone on androgen tendency. Increased insulin due to insulin resistance, I told you just now. And there is a hormone known as SHBG. that is sex hormone binding globulin. Normally what happens, the sex hormone SHBG, this binds the androgen with it and doesn't allow to release the androgen in the bloodstream. What happens in these cases? SHBG is reduced. So when the SHBG level comes down, the androgen becomes little free, and there is free androgen in the blood. And rest is the history. When SHBG will not bind the androgen with it, normally only 1% of free testosterone coming from SHBG. Only 1%. But if SHBG is low due to high androgen, so SHBG, when it becomes low, it releases free androgen. The free androgen becomes 2 to 4%. When it is become 4 to 2% or 2 to 4%, it causes the complications, that is high androgen levels in the blood. I hope this will be clear. This is a total picture of a patient of PCOS. Now, how to diagnose? So when you will go for an ultrasound, we say, I explained in the last class that the graphene follicle, which were not maturing, they normally come, this is the ovary. And they come and arrange themselves around the border like a necklace. String of pearls, necklace kind of an arrangement of, these are the cysts. These are the small cysts. They are arranged in the ovary like a necklace. So this is known as what happens. And to diagnose whether this is a case of PCOS by ultrasound, there is a criteria known as Adams criteria. So what is Adams criteria? The ovarian volume should be more than 10 ml. Due to the collection of over follicles, the volume of ovary will increase. There should be more than 20 immature follicles. These should be more than 20. Before this, after 1 2 years before, this level was considered more than 12. But the latest ESHR society, that is European Society of Human Reproductive Systems, so they have decided that now this should be above 20, then we will consider this as a case of PCOS. And the follicle should be 2 to 9 mm. The mature follicle is 18 to 20 mm. So these are the criteria. The ovarian volume should be more than 10. You see, we treat the patient of PCOS, there is no problem. So many patients are being cured. But nowadays, patients are coming with the reports. They ask, they study in the Google, they study in the internet. So they will ask you, doctor, my ovarian volume is 20 ml. What does it mean? They will ask you that my ovarian follicle size is such and such. What does it mean? So for explaining the patient and for understanding ourselves, we must know these things. You can see this live ultrasound.
This young lady's right ovary. You can't go through it. This is the ovary. And these are the dozens and dozens and dozens of little cysts or follicles where eggs are growing, getting frustrated, and not continuing to grow. The inside of the ovary also has a white, what's called hyperechoic. And here's the area, and this is a string of pearls right along here. In fact, the whole ovary has a string of pearls.
So now we will come to the symptoms of PCOS. So as I told you, the first symptom is hirsutism. Hirsutism is extra growth of hair like males. You can see this picture. This is an historical picture. This lady, is she looking like a lady? She is looking like a man. And she is 52 years old and feeding her child. So this is a historical painting of presence of hirsutism at this level during those times. So which will come? See, this is hirsutism. You will be surprised. This is the lady girl before getting PCOS. This is a lady after the PCOS. So hirsutism is a condition in women that results in excessive growth of dark or coarse hair in a male-like pattern, face, chest, back. With hirsutism, extra hair growth often arises from excess male hormone, that is more androgen, primary testosterone. So this was the girl. Now she is like this. So our motto should be not only diagnose a case, but to have counseling, give counseling to these kind of females. You can understand the situation, the condition of this girl or these type of girls who are getting this kind of a growth, excessive growth. What will she do? What will they? But this girl, she lives in London and she faced the society so nicely. You see the video.
Is it a little bit? Because sometimes when I go to public toilets and someone goes to me,
Everybody is watching her.
oh, this is the women's. And I actually put on a deep voice and I said,
But she is continuing with her life.
So I kind of play around with it. And it's funny because we all end up laughing.
Today, things are looking up for Hanan. She works as a primary school teacher.
She is a teacher.
And she's received dozens of messages.
She is continuing with her normal life.
The world who say they love her beard.
One guy saw my picture and he goes to me, will you marry me?
And she hopes her story will encourage other women to be more body confident.
So
This
this
is me. This is who
is
I
a
am. It's
video
like-
which will tell us that how we should behave with our patients. This is the hirsutism. You can see what kind of growth of hair is coming here. You can see these fully bearded and mustache. These are pictures of patients of PCOS. And the Bible of gynecology is known as Novak's gynecology. So Novak's gynecology says that if a girl is having hirsutism, she is a patient of PCOS. Forget about everything. You can see, if there is a growth of hair, this is a sure sign of PCOS according to Novak's gynae. There is a formula. We will not go to that. There is a formula of counting, calculating the hair growth in the body and then count into a formula. If the point is more than 4 and it becomes a case of PCOS, we will not go to that. Next is, I told you 3 signs. One is hirsutism, one is acne. You can see how severe acne this girl is having. So this kind of acne is present. PCOS can lead to acne because it causes the ovaries to produce more androgen. If there is production of more androgen, the sebum is produced more. Thus, it stimulates the production of oil, sebum in the skin. And that sebum goes into the hair root, settles there, comes out in the form of an acne. Very severe condition, and the patient will come to you that I have applied so thing, I have applied so such and such ointment, such and creams and such and so forth, but this is not cured because this is a hormonal imbalance. This is not a simple acne. This is due to the high androgen level which produce more sebum. The sebum goes into the hair roots, settles there permanently and causes this kind of a growth. Next is male kind of baldness. I told you that the male hormones are more. So when there are more male hormones, the baldness, male type baldness will appear. This kind of baldness is present. This can be a case of PCOS, and this is known as virilization. Virilization means more and more male symptoms pattern in a female. So male type of pattern in a female is known as virilization. Obviously, when there is more androgen, there is more male hormone, so there is virilization. Now come to the next part of the skin. There is a velvety blackish appearance of the skin in the neck and axilla. You can see it is very clear. These are velvety blackish appearance of the skin. Velvety, very soft but growth. So this kind of velvety skin and this kind of discoloration is known as acanthosis nigricans. It is a skin condition that causes a dark discoloration of body folds, characterized by areas of dark velvety discoloration in body folds and increases. And if this is present, when you are diagnosing a case, immediately go for serum insulin level. There is an insulin-like growth factor which is disturbing everything. So in these cases, you will see that serum insulin level is high. And in allopathic practice, you know, maximum gynecologists, they prescribe metformin for these kind of velvety dark appearance. But what is metformin? Metformin is one of the best medicines which for diabetes. And metformin has a good effect that it doesn't produce glucose level low. So there is no hypoglycemia even after you take metformin. And in maximum of cases, the metformin helps in curing these kind of discoloration in allopathic side. Always calculate the BMI of the patient. This is very essential. What is BMI? Body mass index. That is a person's weight in kilograms divided by the square of height in meters. So if BMI is high, we will confirm the patient that you are going towards obesity. This is BMI. 18 to 24 is normal, 25 to 30 is overweight, 30 to 35 is obesity, 35 plus is extremely obese. So this is a chart, and nowadays you will see in every good allopathic prescription, you will find that the hospital also, they always calculate the BMI. Because BMI is the indicator whether the patient is obese or not. This is obesity, one of the most important causes for PCOS. So 50% of patients with PCOS are obese. 80% of these patients are hyperinsulinemic and have insulin resistance. Just please understand this. Obesity, fatty patients, your calcaria carb patients, they are much more prone to PCOS. 50% of PCOS are obese, 80% are hyperinsulinemic. Hyperinsulinemia contributes to hyperandrogenism and associated hirsutism. So all these patients, 2 or 3rd patients are having lean PCOS, have excessive body fat and central adiposity. This is the central adiposity. Male like obesity, जो हम लोग हिंदी में बोलते हैं पेट निकल जाना, मेल्स में जो होता है normally, तो females में उस type का, that kind of a obesity is present in case of females who are obese. You can see, and this kind of truncal obesity, what we call is truncal obesity. These kind of truncal obesity and the PCOS level and the insulin effect, they causes, there will be personal or family history of diabetes, truncal obesity, hyperinsulinemia, hypertension, dyslipidemia. Fat tolerance is not proper, the triglyceride level is above 150. Atherosclerosis, regular problem of these kind of thing, she may be diabetic, and all these combined, if a patient is having, this is very important in diagnosing a case that is known as metabolic syndrome. The doctors prescribe that this patient is PCOS, is having metabolic syndrome. The very important aspect for the diagnosis of a case of PCOS and future complications. The future complication, very important complication in atherosclerosis. If there is high TGL, the patient is prone to having atherosclerosis and high blood pressure. And with this, he may be having diabetes. And there is one more syndrome which is very commonly nowadays diagnosed. आप देखिएगा, you will see that in the prescription, it will be written that hair and syndrome. So very common, please mind it, in the latest prescription level, you will find a case is diagnosed as hair and syndrome. It is nothing. HA is hyperandrogenism, IR is insulin resistance, AN is acanthosis nigricans. So whenever it is diagnosed that this patient is having a hair and syndrome, don't get fear, don't get confused. These are hyperandrogenism, HA, IR is insulin resistance, and AN is acanthosis nigricans. Now this we have already discussed, we'll discuss in very short, that when we go to the blood test for a patient, what will happen? We have already discussed these things. Serum insulin will be increased, insulin resistance, LH, FSH will be more than 3:1, normal is 1:1, testosterone level will be increased. And decrease will only be SHBG, which I have discussed in detail. What will happen when SHBG will be reduced? This is sex hormone binding globulin. If it is reduced, there will be more and more androgen level, and more androgen level will lead to PCOS. So differential diagnosis, how will we differentiate? So there is, one is PCOS, one is hypothyroidism. Hypothyroidism is not a case of PCOS, but hypothyroidism leads for obesity, weight increase. Weight increase and hypothyroidism also disturbs the lipid function, lipid profile. So if the lipid profile is disturbed, you will have high TGL, high cholesterol, leading to some heart disease. Obesity, I have discussed. High PRL. Sometimes you will get a blood test that prolactin levels are high. The prolactin level is not high in every case, but there are patients who are having prolactin, high prolactin. So in case of high prolactin, the menstrual cycle is disturbed and it causes to infertility. So you will have to differentiate whether your case is of PCOS or sometimes due to high PRL, there are disturbance. And one very rare but important cause is congenital adrenal hyperplasia. This is very rare. This happens 1 in 10,000 patients. So obviously it is rare, but due to some small tumor or some malfunctioning of the pituitary gland, there is congenital adrenal hyperplasia. So adrenal gland is having hyperplastic. So if there is hyperplasia of adrenal gland, they will produce more androgen level. And more androgen will lead to symptoms like PCOS. So these are the things by which we can differentiate between the levels. And this is some allopathic kind of a treatment. I just told I would like to name them. One is clomphin citrate. Ye naam yaad rakhiye. Please remember this name. We will need this name. So clomphin citrate is one medicine which helps in the curing of PCOS by sending negative signals to the brain. I'm not discussing in detail. One very safe medicine is letrozole and COMP. COMP is combined oral contraceptive pills. So if a patient of PCOS is given combined contraceptive pills, so they are given what? Progesterone and estrogen in a level. So when the estrogen and progesterone level given orally, the case when FSH was standstill, it was going on a single line, it was not increasing. So this medicine increases the FSH, and when the FSH increased, the graphene follicle starts maturing. The graphene follicles start maturing, there is period. The mens appears, and after 5-6 months like this, the patient may become all right. And fourth is metformin, which I already told you, that for insulin resistance, we try to give metformin, which reduces the insulin level, and the patient feels better because there is, after the insulin level is reduced, there is less androgen. If there is less androgen, the follicles will mature and there will be period. Now, we will come to the homeopathic part. Homeopathically, there are so many good medicines, but I will try to discuss a few medicines only, which are very important. And how should we study the mathematical? So I think everybody knows about CPR. This is the first important medicine. So Dr. P. Shankaran and so many other senior physicians, they have already discussed that the symptomatology of a patient while proving sometimes is very similar to the original thing. So this is made by cuttlefish. You know, all of you that or not? CPI is a medicine which is made by the ink of a cuttlefish. This cuttlefish is having ink and it is very, see, this fish is having changeable nature, very changeable. Turat rang badalti, immediately changes its color. Very fearful, and when attacked, she is very irritable and aggressive. You must have heard. You must have heard the story of Dr. Henneman, how CPR was invented. Dr. Henneman's, one of Dr. Henneman's friend, he was having some problems and was not getting cured. After so many history sessions taken, there was no cause proper. Then ultimately, Dr. Henneman saw him painting besides the sea. He was sitting in besides the sea and having a painting done, and he was using an ink. And that brush he was taking in the mouth to moist it and getting it wet by the ink. And what was that ink? That ink was from sepia. Sepia is having sepia. Cuttlefish is having a sac inside it, which is having an ink. And while it uses the ink in two ways. One, for camouflaging the fishes or small fishes to which she hunted, and second, for flying away from a side where there is a fear. So I will show you how this sepia fish is changing color like sepia patient. Mind it, see it, you will not see it once more. Just see the fish, how she is changing the color according to the environment. Please, please watch it. Now see the color. Now see the color. How is she changing? Now see the color. She can mix up with the plants also. See. You see, this is the fish. See, this is the fish. Completely trans. This is the fish. This is the fish. Green. Can you think this is a fish? See, now this is the fish. So this, what I mean to stress upon is that this change in color is a nature of the fish, and this changeable nature is a very peculiar property in case of sepia. See how she releases the ink. Very interesting video. How the sepia fish releases the ink. Sorry. I think it is visible. This is the ink which Dr. Henneman discovered as sepia. And for hunting, how she changes color and be silent and then hunt.
Amazing.
See the change of color in the skin. You say the change in pigments of sepia.
Controlled by the animal's nervous system. These moving bands of color captivate a wary crab.
How she will hunt for it.
It's close enough.
So now come to the sepia patient, which already we have discussed. Sepia patient is very irritable. We know She is very irritable, but very intelligent. Very sharp, intelligent, but very irritable. And once she gets angry, after that she starts weeping. See, this is a sepia patient. She's very angry, very irritable. But later on, starts crying. So this is a particular of sepia, extremely angry, irritable, indifferent, aversion to sex, constantly crying. This is a sepia patient, very smart, educated, master of her own will, non-compromising, focused, artist, perfectionist. All the good qualities with highly aggressiveness, highly irritableness, and complete indifference after some time. She has no meaning of the family. She doesn't care about the family. She sits, she cries, she is irritable, aggressive. So this kind of a mentality is present. You should give sepia for a case of PCOS. Next is the most important, pulsatilla. Always crying. She's not, mind the difference, she's not irritable. But only crying, very sad, timid, always crying. There are hormonal imbalances, irregular periods, ovarian cysts, suppressed or delayed menses. And it helps to prevent endometrial carcinoma in case of. So this is a pulsatilla patient. I'm not having time to not discuss in more detail. Thuja is one of the best medicines. The mental symptoms should be present. You can see we have discussed that Thuja is having sensation of head is. Thuja is having symptom that the head would fall. So how the patient will feel? The head is fall, the body is made of glass. One of the best medicine for delayed menses with PCOS. Presence of peculiar mental symptoms, as if body is made of glass, as if head would fall. And Thuja is one of the best medicine which should be given intercurrently. In spite of the indicated medicines that you are giving, give Thuja intercurrently, which will help you. In my practice, I am always using this. I am very successful in treating cases of PCOS. There are some more medicines. Calcarea carb, due to constitution, oromironatendrome is a very good medicine when the report will say that the follicles are very hard. And if in many cases you will find that these patients are PCOS patients are having small fibroids also, uterine fibroids. You will say see combination of both. So in that case, oromironatendrome is very good. Palladium is a medicine which starts from the right side and there is pain on both sides. Epismel, when there is swelling, there is liquid inside the ovary, especially right-sided. Thyroidinum, when TSH is high. Oleum jack is one of the best medicine for hirsutism. Whatever medicine you give, oleum jack in 3x potency, prescribed along with the medicine, main medicine, constitutional medicine, will help you reduce the hirsutism. There is iodium, there is left-sided lachesis, there is, if the growth is more, calcarea floor. Natramur is a complementary and chronic. Mind it, Natramur is chronic and complementary to pulsatilla and sepia both. So if you are giving pulsatilla, the patient is responding but not being cured, give Natramur. The same is with sepia. If the sepia is responding, not being cured, follow it with Natramur because it is chronic and complementary. Now, this is my own suggestion. You may agree, you may not agree, but there are some mother tinctures which are very, very helpful. And the first is asparagus. You can see asparagus was so popular. It is known as queen of herbs.
Asparagus was discovered in ancient Egyptian tombs.
The ancient Egyptian from times, it has been popular.
It was so popular with the
It was recognized by the king.
Augustus coined the phrase
Sorry.
Mediterranean. At the
And
end of the
you will
harvest
see
season,
how
plants are
large
gathered
scale,
from
how
fresh
large scale it is being
spear tips
produced.
growing
Asparagus.
in pods. All
In
of this growth will be
Ayurveda,
down
it is
before
known
next
as
year's harvest.
Shatavari. You will get Shatavari
This
capsule. You
starch
see,
went straight to the packing plant.
in what a
where it's
large scale it is being produced because it is so helpful
bundles
in
of
curing
fat
so many
oils.
problems. So it is known as Shatavari. Shatavari means in Ayurveda, it is known as Shatavari because it is so active and so powerful that I should not say that, but it is in literature that Shatavari can have 100 spouses. She becomes so strong, she becomes so normal life loving person. It regularizes period, reduces androgen level, women to decrease facial hair. So for hirsutism, it is one of the best. It manages PCOS induced weight bloating, help controls the hormonal acne, no side effects. Very common in Ayurveda. Shatavari capsule, Shatavari liquid, they are always available in market. So I use mother tincture of Shatavari and get very nice result. And one medicine is most important, mother tincture form, that is, my God.
Branching off to the left. Further down,
Second medicine is Actia racemosa.
branching off to the left.
This is Simicifuga.
Down the primary stalk.
This is a Simicifuga plant.
Another in
And this was being used since ancient times, you can see.
Simicifuga appeared early in the US pharmacopoeia under the name black.
Very ancient times.
19th century,
1830.
treatment, snake bite, inflamed lungs, and
So
pain.
this was being used. And what is the peculiarity of this plant, Simicifuga? You will see that black cohosh it is known as black cohosh. So this is very similar to clomiphene citrate. I told you to remember, please memorize the name clomiphene citrate. This is one of the best medicine allopath to help the case of PCOS. And the same function is having by Simicifuga mother tincture. It acts like clomiphene citrate without any side effects, and it lowers LH. We have discussed several times that if the LH is low, the patient will be better. If the FSH high, the patient will be better. So this medicine, black cohosh or Simicifuga or Actia racemosa, helps in this way. And it is having all the mental symptoms which a PCOS patient is having: mood swings, anxiety, irritability, depression, fear, and restlessness. I'm sorry, I'm going fast because I'm not having time to explain so many things. But this is black cohosh. Another medicine is cinnamon, dalchini, very common household herb. So this medicine also is, this reduces serum levels of testosterone and insulin in mother tincture form. So I have been practicing this since very long, since about 15 to 20 years. Cinnamon mother tincture, or most commonly Shatavari and Simicifuga mother tincture. There is Tribulus terrestris. This is a very good medicine. If you can use it, it is approved, it is tested. This has improved ovulation in PCOS. A study in women showed that FSH levels increased from 11 to 1775 after using 750 milligram dose of Tribulus. After the PCOS natural treatment, FSH levels return to normal. This is a medicine, Tribulus. This is very important for the treatment of. Now come to the surgical part of the treatment. Surgical part, there are 2-3 things. One is ovarian drilling. What is ovarian drilling? Because ovary is secreting more and more androgen. Ovary is producing more and more androgen. What the doctors do, they cauterize some part of the ovaries by drilling and cauterizing. So those parts becomes dead. So because those parts become dead, there is less secretion of androgen and the patient becomes normal. You just see how they are doing this. they are starting to cauterize the ovary. This is the cauterizer. See, this is cauterizing. They cauterize this at 6 to 9 places, and after that, the results are very good. I think you have seen this cauterization. Next is surgical removal. This is a small video by which you can understand
that
how
are
surgical.
naturally available rather than force the tissues away from each other and cause inadvertent.
You see, they are taking out ovary. There is very big ovarian cyst. This is the size of the ovarian cyst. You can see very big. Now this has been taken out. A very small. I would like to show the process of the surgery. So this is the process. They have taken the cyst out. You can see the size. And now you will see a miracle. The largest ovarian cyst in the world
Nigerian woman is actually full-term pregnant, but she also
is
has
pregnant.
a giant ovarian cyst. And this is quite a complication in Nigeria. So in a procedure that looked something like this, doctors were able to remove a massive cyst. And the question is, what happened to the baby? And we'll cover that here in a moment. But first, here's an image of the doctor holding the actual cyst after it ruptured. Holy cow. Technically speaking, the cyst itself exploded during operation, spilling gallons of fluid everywhere. Doctors also performed a C-section and the baby was.
So I think you have seen everything about PCOS in short, how we diagnose, what are the symptomatology, what are the medicines, and this surgery. So, and the most important, one of the most important point in treating a PCOS case is that you must ask the patient to exercise. It has been observed and confirmed that if the patient can reduce 10% of the weight, if the patient can reduce 10% of the weight, body weight, the patient can be better by 50%. Without giving medicines also. So always ask your patient to exercise like this. I am showing you an example how to exercise. So if the animals can exercise, we can also exercise. So I hope you have enjoyed this presentation. Thanks. Thank you very much.
Thank you, Doctor. A very informative, very relevant session. And I think a lot of doctors are here to interact with you. And first is Dr. Rema Devi Ambadi.
Can you
Yes.
hear me?
Yes, yes.
Sir, we really enjoyed.
Thank
So,
you.
so nice class. We were eagerly waiting for this day. The
Thank
other day, no, I told you, no, we were waiting for the next Tuesday. Today, you had fulfilled our wishes. Very good, very nice class. Thank you a lot, sir. Please come again with another subject.
Sure.
Like endometriosis
Sure.
or like that.
My next presentation, Dr. Sahani has told me, I will be presenting a lecture on two parts on sickle core.
Okay.
I hope you will also like this. Sickle core is a very nicely made presentation. So I am very optimistic that you all will like it.
Okay. Thank you, sir. Thank you.
Thanks
Thank
for
you a
calling.
lot. Please
Thanks.
come again.
Thank you.
Thank you.
Next is Dr. Hariharan. Doctor, please, you can unmute.
Can you hear me, sir?
Yes, please.
Sir, your class is very nice and fantastic.
Thank you. Thank you so much.
But see, you have nothing said about AMH.
Pardon?
AMH.
See, there are
anti-inflammatory hormone.
there are 4 hormones which are responsible for this and which play a very important role. Actually, I had to take that slide off because of lack of time. So there are these 4 hormones which play very important role. One is AMH, that is antibular hormone. So antibular hormone is a signal of developing follicles. If the AMH level is low, it means the follicles are not developing. If AMH is high, it is okay. So naturally, AMH declines with age as the number of follicle drop. And importance of AMH is in cases where there is infertility. In normal PCOS cases, the AMH is not that important. That is why I now did not stress on this. But in case of infertility, the patient is not having pregnancy. So we go for AMH level. If AMH is low, then we treat her accordingly. There is PRL I discussed. There is one more hormone, DHEAS. So DHEAS is secreted by adrenal glands and it is a circulating steroid hormone, but it is converted into estrogen or testosterone in the body as per the needs. And I have already discussed the SHBG, that is sex hormone binding globule. Anything more, sir?
Okay. Thank you, sir. Thank you, sir.
Thank you, Doctor. And next is Dr. Hubert De Silva. Doctor,
Hello.
we are having 1 or 2 minutes only, please.
Hello, doctor.
Good evening.
Very nice class. And how to take a class? That is, I already studied from you. That is my great thankful to you. Thank you very much, sir. You must come and we should study more things from you.
Yes.
Thank you, sir.
That's
all.
Next is Dr. Narayana Mittapalli.
Sir, very much thanks for this session, sir. Previous session I missed, but fortunately I got this one now today. Sir is my examiner in the MD medicine in GDM, sir. I'm very, sir, he have questioned me the infection causes renal calculi. My topic is renal calculi. Infection causes renal calculi in the kidney. How it forms, you questioned me, sir.
Okay.
I told that relaxed formation of the infected pus cells and forms this one. But you asked me not relaxed formation, step-by-step adhesions. You told me that, sir.
Yes, yes.
I am Narayan, GDM,
GD
2008.
Yeah.
Yes, sir. Actually, I want to meet you, sir. I want to have a sessions with you, but I could not able to. But now I got the real topic sessions, this PCOD.
Yes.
On par with allopathic teachers, you have given me a very elaborative this session, sir. But in selection of the remedies, you have given only 4, but according to our drugs.
Doctor,
PCOD,
the problem is that the time is so limited that we cannot go in much details of the selection. And I believe that as a doctor, you know how to select a proper medicine as per the mind, as per the totality of symptoms, take the help of repertorization, and you will be able to select the medicines. Because basically this was not a materia medica class. So I was not having much time to give details of all the medicines. It is not possible. It will take another 2 hours. I gave you only 4 important medicines and how to select them. Sepia, pulsatilla, like that. They are important medicines, very important medicines.
Thank you, Doctor. It was a very good class, and we are very eager. We are very keen to listen from you more, and we are waiting for your next class, which is
whenever
going to be...
call, sir. Whenever you call, I will be there. Thank you so much.
Thank you, sir. On behalf of Ifph, I thank you, and I thank all here participated here to listen this wonderful class. And it's time to wind this session and over to Malayalam for a very important meeting. which is going to be convened now itself. Thank you. And over to Dr. Danish.
Thank you, Dr. Binduraj and Dr. Kulwant Singh. Namaskaram. IFBHന്റെ 1079ാമത് ദിന മലയാള വിഭാഗ വെബിനാർ ഇവിടെ തുടങ്ങുകയാണ്. വെബിനാറിന്റെ ആദ്യ ഭാഗമായി 1 മിനിറ്റ് മൗന പ്രാർത്ഥനയാണ്. നന്ദി. ഇന്റർനാഷണൽ ഫോറം ഫോർ പ്രൊമോട്ടിംഗ് ഹോമിയോപ്പതി എന്ന നമ്മുടെ സംഘടന തുടങ്ങിയതിന് ശേഷം ഹോമിയോപ്പതി ഒത്തിരി പ്രതിസന്ധി ഘട്ടങ്ങളിലൂടെ തന്നെയാണ് കടന്നുപോയിക്കൊണ്ടിരിക്കുന്നത്. അതിലേറ്റവും സുപ്രധാനമായ ഒന്നാണ് നമ്മുടെ പൊതുജനാരോഗ്യ ബിൽ എന്ന പേരിൽ നമ്മുടെ സർക്കാർ അസംബ്ലിയിൽ അവതരിപ്പിക്കുകയും എന്നാൽ ചർച്ച പോലും ചെയ്യാതെ പാസ്സാക്കിയതായിട്ട് പ്രഖ്യാപിക്കുകയും അത് ഗവർണർക്ക് വിടുകയും ചെയ്തു. ഇങ്ങനെയുള്ള ഒരു ബില്ലിനെ കുറിച്ച് ആധികാരികമായി ചർച്ച നടത്തേണ്ടത് നമ്മുടെ ആവശ്യമാണ്. കാരണം ഗവൺമെന്റിന്റെ ഭാഗത്തു നിന്നുള്ള സമ്മർദ്ദം കൊണ്ട് അത് വീണ്ടും ഒപ്പിടണം എന്നുള്ള രീതിയിലോട്ട് സമ്മർദ്ദങ്ങൾ ഏറി വരികയാണ്. ശരിക്കും പറഞ്ഞാൽ നമ്മുടെ പൊതുജനങ്ങൾക്ക് ദ്രോഹകരമായ ഒരു ബില്ലാണ് അതെന്ന് പറയുന്നതിൽ യാതൊരു മടിയുമില്ല. അതുകൊണ്ട് തന്നെ ആ വിഷയം നമ്മൾ ഒരു ഹോമിയോപ്പതി ഡോക്ടർ എന്നുള്ള രീതിയിലല്ല, അല്ലെ ഹോമിയോപ്പതി സമൂഹം എന്ന രീതിയിലല്ല, ഇത് പൊതുജനത്തിന് വളരെ ദോഷകരമായ ഒരു ബില്ല് തന്നെ ആയതിനാൽ നമ്മുടെ ആരോഗ്യ മേഖലയിലെ വിവിധ രംഗത്തുള്ള ഡോക്ടർമാരെയും അതുപോലെ തന്നെ പൊതുപ്രവർത്തകരെയും മാധ്യമ പ്രവർത്തകരെയും ഒക്കെ ഉൾപ്പെടുത്തിക്കൊണ്ടുള്ള ഒരു ചർച്ചയാണ് ഇന്ന് നടക്കുന്നത്. എന്തുകൊണ്ടെന്നാൽ നമ്മൾ ഈ ഓഗസ്റ്റ് 17-ാം തീയതി തിരുവനന്തപുരത്ത് കനകക്കുന്നത് കൊട്ടാരത്തിന്റെ മുന്നിൽ നിന്നും ഒരു ജാഥ തുടങ്ങി നമ്മുടെ രാജ്ഭവന്റെ മുന്നിൽ വെച്ച് ഒരു സംഗമം നടത്തുകയാണ്. അത് സംഗമം എന്ന് പറയുമ്പോൾ ആരെയും എതിർക്കാനല്ല, നേരെ മറിച്ച് ഹോമിയോപ്പതിക്ക് വേണ്ടി അല്ലെങ്കിൽ ആയുഷ് രംഗത്തുള്ള വിവിധ ചികിത്സാ സമ്പ്രദായങ്ങളെക്കും തുല്യത വേണം എന്നുള്ള അഭ്യർത്ഥനയോടുകൂടി നടത്തുന്ന ഒരു പരിപാടിയാണ്. അപ്പൊ അതുകൊണ്ട് തന്നെ അതിൽ എല്ലാവരും പങ്കെടുക്കേണ്ടതായിട്ടുണ്ട്. അതിനുള്ള മുന്നൊരുക്കങ്ങളെക്കുറിച്ചും എന്തുകൊണ്ട് ഇങ്ങനെ ഒരു ബില്ലിനെ നമ്മൾ ഇങ്ങനെ എതിർക്കുന്നു എന്ന് പറയുന്നതിനൊക്കെയാണ്. അപ്പൊ തീർച്ചയായും വെബിനാറിന്റെ ആദ്യ ഭാഗമായി സ്വാഗതം പറയുന്നതിനായിട്ട് ജനകീയ ആയുഷ് ആരോഗ്യ കോൺഫെഡറേഷന്റെ കൺവീനറായ ഡോക്ടർ BK ദേവരാജിനെ സ്വാഗതം ക്ഷണിക്കുകയാണ്.
എല്ലാവർക്കും നമസ്കാരം. ആമുഖമായി ഡോക്ടർ ധനേഷ് പറഞ്ഞ പോലെ തികച്ചും ജനവിരുദ്ധമായ ഒരു ബില്ലാണിത്. എല്ലാവർക്കും ആദ്യമായിട്ട് ഞാൻ സ്വാതന്ത്ര്യദിനം ആശംസകൾ നേരുകയാണ്. ഈ സ്വാതന്ത്ര്യദിന ആശംസകൾ നേരുമ്പോൾ തന്നെ ഞാൻ വളരെ ആശങ്കയിലാണ്. ആരോഗ്യരംഗത്തെ സ്വാതന്ത്ര്യം നഷ്ടപ്പെടുന്നു എന്നുള്ളൊരു ആശങ്ക. ഈ ബില്ല് വന്നു കഴിഞ്ഞാൽ ആരോഗ്യ രംഗത്തെ നമ്മുടെ സ്വാതന്ത്ര്യം, നമ്മൾ ഇന്ന് അനുഭവിച്ചുകൊണ്ടിരിക്കുന്ന സ്വാതന്ത്ര്യം നഷ്ടപ്പെടുമോ എന്നുള്ള ഒരു സന്ദേഹമില്ലാതില്ല. എന്തായാലും നമ്മുടെ ഇന്നിപ്പോൾ നിയമസഭ പാസ്സാക്കിയിരിക്കുന്ന ഈ ബില്ലിൽ ഒളിഞ്ഞിരിക്കുന്ന ഒരുപാട് ചതിക്കുഴികളുണ്ട്. പഴയ ബില്ലുമായിട്ട് ഈ ബില്ലിന് കുറെ വ്യത്യാസങ്ങൾ ഉള്ളപ്പോൾ തന്നെ അന്നത്തേത് പ്രകടമായിട്ടുള്ള ഒരു ആക്രമണമായിരുന്നെങ്കിൽ ഇന്നത് ഒളിഞ്ഞു നിന്നുള്ള ഒരു ഒളിമറയിൽ നിന്നുകൊണ്ടുള്ള ആക്രമണമാണ് ഇന്നിപ്പോൾ സംഭവിച്ചിരിക്കുന്നത്. ഇതിലെ പല വകുപ്പുകളും അവരുടെ നിലനിൽപ്പിന് വേണ്ടി മാറ്റിയിട്ടുണ്ട്. നിലനിൽക്കുന്ന നിയമങ്ങൾക്ക് വിരുദ്ധമായ പല വകുപ്പുകളും മാറ്റിയിട്ടുണ്ടെങ്കിലും അടിസ്ഥാനപരമായിട്ട് മനുഷ്യന്റെ അവകാശത്തെ ഏത് ചികിത്സ തേടണം എന്നുള്ള അവകാശത്തെ ഹനിക്കുന്ന രീതിയിൽ തന്നെയാണ് ഈ ബില്ല് ഫ്രെയിം ചെയ്തിരിക്കുന്നത്. നമ്മൾക്കത് മനസ്സിലാകുന്നത് അതിന്റെ വകുപ്പുകളിലൂടെ പോകുമ്പോഴാണ്. അതില് ഇവിടെ പറയുന്നത് പണ്ടത്തെ നിന്ന് വ്യത്യസ്തമായി ആരോഗ്യ അധികാരി എന്നുള്ള പേര് മാറ്റി ഹെൽത്ത് ഓഫീസർ എന്നുള്ള ഒരു പേര് കൊടുത്തു എന്നുള്ളതല്ലാതെ അധികാരങ്ങൾ ഇപ്പോഴും അദ്ദേഹത്തിൽ തന്നെയാണ് നിക്ഷിപ്തമായിരിക്കുന്നത്. അതിനുവേണ്ടി ഒരു കമ്മിറ്റി അതിനുവേണ്ടി തീരുമാനിക്കാൻ ഒരു സമിതിയുണ്ട്. സമിതിയിൽ എല്ലാവർക്കും അംഗങ്ങളുണ്ടെങ്കിലും ഒരു എപ്പിഡമിക്കോ അങ്ങനെയുള്ള സംഭവങ്ങളോ പൊട്ടിപ്പുറപ്പെട്ടാൽ, അതിപ്പോ കാലാവസ്ഥാ ദുരന്തമായാലും മതി, പ്രളയം പോലുള്ള സംഭവമായാലും മതി, അത് പ്രത്യേകം ബില്ലിൽ പറയുന്നുണ്ട്. അങ്ങനെയുള്ള അത് പൊട്ടിപ്പുറപ്പെട്ട് കഴിയുമ്പോൾ എന്തൊക്കെ കാര്യങ്ങൾ ചെയ്യണം എന്ന് തീരുമാനിക്കുന്നത് ഈ ആരോഗ്യ അധികാരിയാണ്. അതിന്റെ പ്രോട്ടോകോൾ പ്രഖ്യാപിക്കുന്നതും അത് നടപ്പിലാക്കുന്നതിനുള്ള ഉത്തരവാദിത്വം കൊടുത്തിരിക്കുന്നത്, പിന്നെ അധികാരം കൊടുത്തിരിക്കുന്നത്, ഉത്തരവാദിത്തമല്ല അധികാരം കൊടുത്തിരിക്കുന്നത് ഈ മെമ്പർ സെക്രട്ടറി എന്ന സ്ഥാനം കൂടിയുള്ള, അതായത് ഈ ഹെൽത്ത് സമിതിയിൽ മെമ്പർ സെക്രട്ടറി എന്നുള്ള സ്ഥാനം കൂടി കൊടുത്തിരിക്കുന്ന ആരോഗ്യ ഹെൽത്ത് ഓഫീസർക്കാണ് സംസ്ഥാന തലത്തിൽ ഡയറക്ടറും ജില്ലാ തലത്തിൽ DMOയും പ്രാദേശിക തലത്തിൽ പ്രാദേശിക PSCയുടെ ഡോക്ടർമാരും ആണ് ആ അധികാരം കൈയാളിയിരിക്കുന്നത്. അതിനൊരു കമ്മിറ്റി ഉണ്ടാകും എന്ന് പറയുന്നുണ്ട് ബില്ലിലെങ്കിലും ആ കമ്മിറ്റിയെ നിർവചിച്ചിട്ടില്ല. അത് നിർവചിക്കാത്തത് ദുരൂഹമാണെന്ന് ഞാൻ പറയാൻ കാരണം വളരെ ചെറിയ കാര്യങ്ങൾ കൂടി കേരള സർക്കാർ എന്താണെന്നുള്ളത് നമ്മൾക്ക് എല്ലാവർക്കും അറിയാം. കേരള സർക്കാരിന് ബില്ലിൽ കേരളത്തിൽ അവതരിപ്പിക്കുന്ന നിയമസഭയിൽ അവതരിപ്പിക്കുന്ന ബില്ലിൽ കേരള സർക്കാർ എന്ന് വിവക്ഷിക്കുന്നത് എന്തായാലും കേരളത്തിലെ ഗവൺമെന്റ്, കേരള ഗവൺമെന്റ് തന്നെയാണെന്നുള്ള കാര്യത്തിൽ ആർക്കും സംശയമില്ല. പക്ഷെ കേരള സർക്കാർ എന്ന് കഴിഞ്ഞാൽ എന്താണെന്നുള്ള നിർവചനം കൊടുക്കുന്നുണ്ട്. ഓവുചാൽ എന്താണെന്നുള്ള നിർവചനം കൊടുക്കുന്നുണ്ട്. പിന്നെ അണുബാധയെക്കുറിച്ച് നിർവചനം കൊടുക്കുന്നുണ്ട്. കെട്ടിടം എന്താണെന്ന് നിർവചനം കൊടുക്കുന്നുണ്ട്. പിന്നെ അങ്ങനെയുള്ള